this video, so I'm gonna go over MI versus CHF. Tell you exactly what you need to know, no more, no less, no fluff. So go, make sure to save and share this out. So the way I like to remember MI, which is a heart attack, is that's like the drama queen, where plaque has built up and then it ruptures in the coronary artery. A clot forms from it breaking off, bam, blood flow stops. Why does it happen? Smoking, high cholesterol, diabetes, family history, or stress. Need to think the heart is starved of oxygen. If you don't fix it fast, that tissue will die. So the symptoms are that crushing chest pain, radiate to the left arm or the jaw. It's sweaty, diaphoresis, you have shortness of breath, nausea, and you have that feeling of impending doom. Your interventions are gonna be your MONA, which is gonna be your morphine, your oxygen, your nitro, aspirin. These patients are at a higher risk for dysrhythmia, so they really need to be on medications that's gonna regulate that heart rate. The medications we're gonna administer them after an MI is going to be beta blockers, statins to lower the plaque and cholesterol, and you're gonna give them anticoagulants to decrease the risk of blood clots. The biggest safety tip with this is do not give nitro if the blood pressure is lower than 90, or if they're on Viagra. The way I like to remember it is MI is minutes immediately matter. The time affects the muscle and perfusion. Now CHF is congested heart failure. I think of this as like a long-term toxic relationship. This is when the heart cannot pump effectively. The muscle is weak and the blood starts to back up. Why does this happen? Because of repeat damage, like AMI, hypertension, cardiomyopathy, or some kind of valve disease. It's like a slow burn compared to like the MI sudden chaos. Now, there's two different types. On the left side, it is going to affect your lungs, L and L. This is where you're gonna have your crackles, your orthopnea, paroxysmal, nocturnal, dyspnea. Right-sided heart failure is going to be rest of the body. So think R for right, R for rest of body. This is where you're gonna get your JVD. This is where you're gonna get your edema, your ascites, your hepatomegaly. Nursing intervention for this is gonna be the acronym UPLOAD. So you're gonna sit them in an upright position. Nitrates, Lasix, oxygen, ACE inhibitors, and digoxin. Safety tip is you monitor your daily weights. This is the best way to monitor any kind of fluid shifts. They need to be on a low sodium diet, so they are not retaining more fluids. They're already in fluid overload. They're gonna be on fluid restriction. You're going to monitor their potassium. You're gonna give Lasix to decrease the potassium and spironolactone to increase your potassium. The memory trick for this is CHF is can't handle fluid. I want you to think drowning on the inside. So MI, I want you to think sudden, acute, emergency, and minutes matter. CHF, chronic, progressive, fluid overload, and it needs to be managed daily. But here's the kicker, is MI can lead to CHF. Later on, because all of that dead muscle that is the residual of the MI can weaken the heart. It weakens the pumping of the heart. MI is like that messy one-night disaster that you'll never forget. CHF is your long, drawn-out relationship that keeps bringing you baggage. Be tested most likely on both of these. So make sure to save and share this out. Go to the top of my page and grab my study notes. They are an excellent addition to your study session. And happy studying!